Let's welcome back to the show House Judiciary's Republican Greg Steube. Congressman, it's great to have you back on. Okay, former Assistant Attorney General John Dawkins out with a heavy-duty op-ed saying that Governor Andrew Cuomo's underreporting and cover-up of nursing home deaths from COVID-19 could lead to potential federal criminal charges, obstruction of justice, defrauding the government. What do you think?
Well, you know, it's one thing to make mistakes as a leader and send COVID-positive patients into nursing homes where you have all at-risk individuals and then have those individuals die at high numbers and then admit that you made a mistake as a leader. It's another thing to intentionally and deliberately mislead federal officials and mislead the public about the deaths that he had in nursing homes, all because of policy positions that he took as the governor of the state of New York. So if he violated, and it appears based on the language being used and now what we're finding out from people coming forward, that he deliberately and intentionally misled the public, misled the FBI. And when you have members of the DOJ and the FBI investigating deaths due to COVID in nursing homes and you're not being honest with them and you're giving them misinformation, that could be punishable under federal law. So I hope that there's a full and fair investigation on this and we get to the bottom of this. But if the facts that we know now, as it's been stated, are true, there's a lot of federal offenses here that Governor Cuomo himself may have violated. And you can't tell me that he didn't know this information, that these deaths were occurring, and that these decisions to misrepresent this information was being made at a level below him.
Yeah. The U.S., it should be noted, just passed just around 500,000 people now dead from COVID-19. This is a DOJ probe involving False Claims Act in Medicare and Medicaid. And Congressman Cuomo stonewalled Democrats and then stonewalled the Justice Department's Civil Rights Division, which demanded the data for all 600 New York nursing homes. It has jurisdiction to investigate Medicare and Medicaid fraud. Is that where this is headed?
Well, and he stonewalled the Trump administration just saying this was a political hit job, when in fact it absolutely wasn't. This was a factual assertion to get actual information from the deaths. I mean, look at New York and compare it to states like Florida. They've had 16,000 more deaths than the state of Florida. We're larger, we're more diverse, and we have a more elderly population. It's because of the decisions that they made. And then to hide and misrepresent that information, not only to the DOJ, but to the American public, is a disgrace to America. It's a disgrace to citizens of New York, and he should be held accountable if he's violated federal law.
It meant the government and CDC scientists did not have the right data in order to track and stop the spread, because New York State is considered a gateway into other states. They were being misled when they're trying to, again, to stop and track the spread where it was going. So government health officials were misled. Cuomo's been accused of a pattern of compulsive bullying to silence people from speaking up. So that's a factor, too. And the backstory to this, Congressman, is nursing home executives, hospital executives got blanket immunity from lawsuits after they gave millions of dollars in political donations to Governor Andrew Cuomo. Remember, he ordered the patients back in. He said, don't test them. And then he gave them blanket immunity. And a lot of states, congressmen mimicked and copied and pasted what Governor Cuomo did. The states weren't doing this blanket immunity. Now it shuts down whistleblowers inside nursing homes. We've got 37 states that have this blanket immunity from lawsuits protection. And, you know, the New York Democrats are saying you're 7.5 times more likely to die in a nursing home in a state with that legal protection. What do you say?
Well, which is exactly why in states like Florida, our governor here in Florida decided to limit any visitation at all into nursing homes, to not send any COVID-positive patients into nursing homes, because we all know the facts that those individuals that are at nursing homes are more at risk. So to make a different determination and then try to hide that information to the American public, how many people in Florida died as a result to the decisions that were made and the information that was misrepresented because there were other states that were making decisions based on the decisions that were being made in New York because they had such an epicenter of cases in the beginning. So how many lives could have been saved if we would have gotten the accurate information that was hidden from us from New York Governor Cuomo?
Okay. Congressman Steube, it is so great to have you on. We're so grateful you joined us. Thanks for your insights there. Come back soon.
Thanks for having me.